How to perform the augmentation maneuver. First of all, let's start with the patient positioning. The patient is generally standing, as the examination of the veins is well performed when the veins are under full distension, and standing will cause full distension of the veins. The operator is sitting next to the patient and will use both hands, one hand to identify the vein that we want to examine and the other hand to give a contraction of the calf muscle as shown in this video. Let's see step by step how to perform the maneuver. We will focus first on the color flow Doppler, and then we will assess the pulse wave Doppler. With the color flow Doppler, we need to use a transverse view. We need to use B mode to identify the vein first, in this case the gray saphenous vein, optimize the image, depth, focus, and gain. Once we have optimized it, we apply the color flow Doppler. We must give an angle to the probe, like shown in the video, as this will increase the color flow sensitivity. And we need to optimize the color Doppler setting. Therefore, use a straight box if you are in transverse, place it over the vein that we are assessing. Make sure you have the right scale setting. In this case, we have set blue as the venous blood, therefore the augmented flow will be blue. Once we are ready, we can firmly squeeze the cuff, as shown in the video, and we repeat this more than once, and give yourself a little bit of time in between compression, and we can see that there is an augmentation of the flow as represented by an abrupt increase of the blue hue. In details, when we increase the venous flow, we can see an augmentation of the blue color, as in this case, followed by a red hue, which is basically the paraphysiologic reflux. This is normal appearance, but let's see what happens when we're going to see an abnormal vein. Again, we have set the blue as the venous blood, therefore when we increase, we have abrupt increase of blue and then appearance of red. You can see in this case that the red remains for longer compared to the normal response that we have just seen. Remember that the color setting can vary, therefore you can set the red as your venous flow, therefore when you increase you will see more red, and when you release the cuff you will see actually blue as the reflux. Therefore you can just change the setting as you prefer. Conventionally, the blue is the venous flow. You can use the longitudinal view as well using the augmentation maneuver, and this is very useful to visualize patency and filling defects of the vein, generally used for the DIP system. If you want to quantify the reflux, you must use the pulse wave Doppler, as the color flow will just give you a qualitative information. Reflux is defined as the presence of retrograde flow after the augmentation maneuver greater than 0.5 seconds for the superficial system and greater than 1 second for the DIP system. You can see here that after the augmentation of the flow, we have a retrograde flow which lasts for longer than 0.5 seconds. This is a severe reflux. In normal situation, as we mentioned earlier, you will see a presence of a partial retrograde flow, which is a normal finding, and it's a paraphysiologic reflux, which lasts less than 0.5 seconds. The duration of reflux is a parameter that's used to grade the severity